Good afternoon. This is Jolene Dreher, and I'm here to discuss Resolving Ethical Dilemmas, Chapter 16, with Nursing 916, Practitioner Roles in Primary Care, Dr. Janelle Harding, Fort Hays State University. Making ethical decisions in practice. While we are required to make ethical decisions on a daily basis, some of those decisions about patient care should be ethically justifiable. Sometimes the right course of action is straightforward and practical judgment is all that is required. However, others can be challenging due to the family, the patient and the families with the healthcare team, due to communication, and deciding what is in a patient's best interest when they cannot decide for themselves. Resolving these issues within the family, the patient, or within the healthcare team requires ethical awareness, ethical knowledge, and reasoning skills. How can implementing ethical decision-making be done? Well, first of all, you have to identify that there's an ethical issue that requires the attention. That means knowledge of that ethical principle and concept will help to increase your awareness of the ethical dimension of your practice. For example, recognizing potential breaches of confidentiality or the importance of appropriate consent. Understanding the context will also require knowledge of the relevant facts of the case. By knowing the risks and the benefits of a treatment may influence how to respond to someone who refuses it or inform the assessment of whether it is in their best interest to have it. Recognize that there are different perspectives, primarily about values, specifically moral values, and ethical dilemmas arise when there are conflicting values at stake. It's not only moral values that are important, however, it is how we value certain aspects of our lives and how will we make decisions about medical treatments when we inform about those. If being independent is a priority for me and I'm paralyzed, then I may be prepared to risk significant harm from surgery for a small chance of being able to walk again. Also, cultural and religious values are closely linked with moral values and will influence how a person, whether patient or healthcare professional, approaches particular decisions that are going to be made. Decision-making that requires ethical justification, and in the case of healthcare, these decisions may have to withstand public scrutiny and challenge. So having a sound knowledge of relevant ethical theory and principles is necessary both to help work through those dilemmas and reach ethical conclusions and articulate the reasoning process to others. Conflicts arise because of failure of communication between doctors, patients, and families, or between members of the healthcare team. Good communication is essential between all of these people, and a resolution is only possible with open, respectful communication between those involved. Deliberation is an important ethical tool, and it is important to emphasize the importance of process and the dialogue. By seeking advice and support when faced with ethical difficulties or conflict, seek out advice from colleagues. The multidisciplinary team provides a forum for seeking the perspective of others, testing ethical reasoning, and reflecting on the values of all the individuals involved. Difficult ethical decisions, like difficult clinical decisions, are often made by teams and not individuals, and benefit from the expertise and experience of a range of different people. However, some of these difficulties cannot be resolved within the team, therefore there may be other resources available in the organization. That is why it is very important to know if your place of employment will have clinical ethics committees or groups that are going to be able to provide support to the clinicians, especially on ethical decisions and issues that relate to patient care. Knowing differences in ethics and law will also help contribute to resolving these issues. With ethics, there's an overlap between ethics and the law. While ethics is a branch of philosophy that discusses and analyzes what is good for the individual and for society, and the answers are rarely black and white, The law are set rules about what is right and wrong, permitted or illegal. These laws are also made by state legislatures, the United States Congress, regulatory agencies, or even the courts. Attempts to have answers in black and white, but they are very rare because there are so many gray areas and loopholes that people try to understand and make their own perception. While there are many definitions that are used in the medical world, there are some definitions that are used in academics and nursing, such as beneficence, which benefits others by preventing harm. Justice, treat others equitable and distribute the benefits and the burdens fairly. Fidelity, which is loyalty, fairness, truthfulness, advocacy, and dedication in relationships. Non-maleficence, the obligation not to inflict harm. Respect for autonomy, acknowledge a person's right to make choices based on personal values. While nurses have the Florence Nightingale Pledge to be able to look back on, a doctor also has Hippocrates as part of the Hippocratic Oath. We can also include that into our future practice by make a habit of 2 things: to help or at least to do no harm. Human error can occur in any profession. However, medical errors most commonly occur in a healthcare system, which may delay patients' recovery and procedure harm to patients. When a medical error occurs, it's challenging to inform the incident to the patients and to the family. Healthcare professionals follow a professional code of ethics to do well and not harm patients. Historically, many of these errors were not disclosed to patients, but the trend for more open disclosure of medical errors to patients and their families is a mutual, beneficial, and welcome change. As you can see, there are some ethical principles that can be followed with an ethical decision-making model called MORAL, which was created by Patricia Chrisham in 1985. And it's a systematic approach to handle an ethical dilemma. In our daily practice, we are uncertain whether to disclose or not disclose any error to a patient, such as whether we forgot to give a medication, we gave somebody else their medication. However, literature on this phenomenon revealed that patients are interested to be aware, and they want to know of the error that may cause them harm, and it is their right to have full disclosure of an error. It's been documented that patients may feel annoyed initially. However, later disclosure has enhanced that the trustworthiness, and they are reassured from the clinician that they were getting the complete information about their care, even if it's bad. Furthermore, findings also affirm that patients acknowledge that healthcare professionals are human beings who are not perfect, thus their chances of error increase, and that it's just human nature. So, are there ethical obligations and absolute duties that we need to be accountable for? With this particular theory and model, it may not resolve all the ethical dilemmas, but it can be used as a tool which may provide a systematic direction to weigh and choose that be disclosed to the patient, but yet this practice is not very common in healthcare. So ethical practices in healthcare, it's important that they be reinforced of truth-telling and honesty, and that should be a part of all healthcare professionals. And it's a reflective practitioner whereby they learn on reflecting and emphasizing patients' values related to that disclosure. And it should be a very important part of our future practice when we're out there as a nurse practitioner. So what are some of the issues that can occur in daily practice? Whether or not to disclose that a mistake has been made regarding care. Whether payment should determine services. Whether and when curative treatments should be stopped. When and how to terminate a relationship with a patient. Whether or not to accept a gift or meal from a vendor. Whether to discuss the deficiencies of the patient's insurance coverage with the patient. whether and how to tell a patient you are moving to another practice, whether and how to inform a patient you believe that a surgeon the patient has chosen is competent or not. These are things that can come up on a daily basis that you may be asked, you may be forced, to deal with. And you also have to take a look at your own moral compass and determine how you're going to answer those questions with your patients. Another way for us to be able to look at how we're going to answer those questions of dilemmas is we also look to the American Nurses Association provisions for a code of ethics for nurses that we should still follow even though we will be NPs. We are going to practice with compassion and respect for the inherent dignity worth of every person. Our primary commitment is to the patient. We promote, advocate for, and protect the rights, health, and safety of the patient. The nurse promotes, advocates for, and protects the rights, health, and safety of that patient. The nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to provide optimal care. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, and maintain competence, and continue personal and professional growth. The nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. The nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. The nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. The profession of nursing, collectively through its professional organization, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. So as we analyze any type of ethical situation that we are in, we need to remember that we need to gather information, consider the laws that are governing the situation. Who is it benefiting? Who is being hurt? Do I have a gut feeling about right or wrong? And if you have that gut feeling, please stick to that gut feeling and don't back down. Are you being swayed? What would other practitioners do? Does my state board of nursing have guidance on this particular situation? Does my malpractice insurance cover me in the event that there was harm done? Structure a plan, present the issue to the patient, present the matter to your business partners if you are in a clinic, and follow the code of conduct from your government agency. Then make a decision about what you're going to do. Thank you. And here are my references.